There are about 45,000 children in Davidson County under the age of 5. None of them can take care of themselves, obviously. They need help. And many of them are in child care because 7 out of 10 mothers with children under 5 are in the workforce. So there is a great need for alternate care. You can quickly do the math to learn how many children that is that are in alternative care to their home. The guidance of the Federal Department of Health and Human Services is that a household should have to pay no more than 10% of their annual income for child care. That's their guidance. The fact of the matter is that in Tennessee, across the entire state, that gives consideration to both urban and rural settings and all levels of care. Infant care in Tennessee costs annually a family about $7,700, about $7,700. A 4-year-old's care across the state averages about $6,500. Do the math again, 10%. If that is 10% of your household income, you're in the $77,000 range for infant care and the $65,000 range for 4-year-old or preschool care.
The USDA reports that 46 billion pounds of food goes to waste in this country every year. And the flip side statistic of that is that there are 40 million Americans at risk of hunger. Bringing that a little closer to home, Tennessee ranks 40th in food security. And in the 2011 Feeding America Hunger Study, 100,000 people are food insecure in Davidson County. 30,000 are children. Being food insecure, the definition is lacking access to enough food for an active, healthy lifestyle for all of the household members. Being limited to the availability of nutritionally adequate foods. We know that 70% of the students enrolled in Metro Davidson schools are on the free or reduced price lunch program. Metro Health Department supplemental food program also provides 3,000 senior citizens with enough food to get them through their monthly needs. So this shows us that we have a lot of hungry neighbors here in Davidson County.
21% of Davidson County residents are uninsured. So I haven't done the numbers on that data, but I'm guessing it's probably somewhere around 120,000 or so folks here in Davidson County. Salome provides care for probably about 5,000 to 6,000 of those folks. Salome is one of probably, I would say maybe 10, I didn't do a count, of clinics that serve the poor in Nashville. Salome is probably one of 3 of those clinics that would consider themselves a Christian ministry. So just thinking about these other clinics, maybe a total of 10, serving anywhere from 5,000 to 10,000 patients each. I'm sure that's probably a little high but we're probably reaching about half of the uninsured people right now in Davidson County. So when healthcare reform that has been passed comes into effect in 2014, it's going to make a significant dent in the uninsured in Davidson County, but there still will be a sizable number of uninsured. There is not going to be any extra spaces. We already turned people away at Salome as it is now. In 2014, and by the way, we consider ourselves 100% uninsured, meaning that we don't really take any insurance at all, no Medicaid, no TennCare, nothing like that, no Medicare. But we suspect that we will still have demand for our services and we'll be turning people away in 2014.
First, I want to share with you a little bit about what are home and community-based services. Essentially, they're designed to assist adults with disabilities and seniors to remain in the familiar surroundings of their home as long as possible, rather than go to a nursing home or another assisted living institution of care. Services are designed to be supportive and range from things such as homemakers, personal care assistants, adult daycare, supplemental food, and transportation. In general, most people prefer to remain in their own home as they age. This makes sense. People would much rather remain in their familiar surroundings with their friends and neighbors rather than going to an institutional setting. This is a very good thing because the home and community-based services are generally much more affordable than the around-the-clock services in an institutional setting. Costs for annual nursing home care range anywhere from $55,000 to $80,000 per year, whereas home and community-based care services range anywhere from $18,000 to $30,000 depending on the level of care that is actually needed. There's a very growing need to find creative ways to best utilize these very limited Medicaid dollars for those who are living in poverty. In 2008, Tennessee, through TennCare, instituted Choices. Choices rebalanced Medicaid funding to support more home and community-based services. As a reminder, this is what the consumer actually wants. Most consumers want. They want to stay in their home. And in addition, this is a much more cost-effective option. Since the statewide launch of Choices, total enrollment for home and community-based services has shifted from just 17.5% to 25.7% in 1 year. This is a great thing. Another way for low-income elderly and disabled persons to access home and community-based care is through the Options for Community Living program, or Options, a lot easier. This differs from regular Medicaid because there's no spend-down requirements, and the state establishes the type and frequency of services an enrollee actually receives. As of October 2011, there was a waiting list of 1,312 applicants for Options, and the typical waiting time is 12 to 14 months.
As you all know, when you have to factor in the other costs in addition to your rent with the food, the transportation, the child care, it's really hard to find affordable housing when you're working a minimum wage job. And quite often, we find that a lot of our participants have to work 2 minimum wage jobs to be able to afford their apartments. The Next Door started several years ago working with women who came out of incarceration. They came to our residential program and we provided intensive case management, counseling, job training, and recovery support services. And we got into the housing arena because our clients were coming back to us and saying, I learned all of these skills. I learned how to cope with my mental illness while I was with you. But when I left the program, I didn't have anywhere to go that I could afford to live except back to my old neighborhoods, my old friends, and I'm starting to slip again. And so we thought, okay, we spent all of this time and effort working with these women. This is a need they have, so we'll try to address that. So in 2007, we purchased a 20-unit apartment complex, and our women lived there with their children. But that we are trying to prepare them to live on their own and be self-sufficient, which includes a lot of those costs that we just talked about. Most of our women that we have are young mothers, so they have their children. So they have the expense not only of just feeding them, but have you seen the list of school supplies that come out every year from the classrooms? And uniforms, and feeding your children, learning the time management skills it takes to function as a family unit, knowing you have to get up early enough to not only get yourself ready for work, but get your children up and either get them to childcare or get them to school on time. Most of our women have grown up in generational poverty, incarceration, addictions, all of those types of environments. So we're constantly working with them on sometimes what would seem very simple skills, like just how to clean your house, how to organize things, how to cook a nutritious meal, how to shop on a limited budget. So we're teaching them those kinds of skills as well, not just you've got to pay your rent, but trying to help them understand how to work and live as a family unit.
Martha O'Brien Center is a generalist, and we have many, many specialties inside our organization. But I want to talk a minute about how we see poverty. We are located in James Casey Homes, which is one of the largest concentrations of the very poorest people in our city. People often focus on the material poverty, but I will tell you from our experience that those things are challenges, but it is the spiritual poverty that we see more challenge with. There's a young theologian that's going around the country right now talking about relational poverty. And he's been all over the world and on 7 continents. He has set up this scenario and asked 3 questions. The scenario is, everyone in this room has just lost all your material wealth. There is not a car in the parking lot. There is not a job to go to. So then he asked 3 questions. The first one is, could you leave this place? And how would you do it? The second question is, would you have a meal tonight and would you have somewhere to stay? And on all 7 continents, the answer is always the same. Yes, I could find someone to help me get a ride from this place, and I would have a meal tonight, and I would even find a place to stay tonight. And the reason that those are always positive questions is because we have people. So the poverty is about not having people. And in Casey Homes, we see this all the time. At Stratford High, we see this all the time. That people can solve their own problems. No one wants anyone else to solve their problems. There's no dignity in someone else solving your problems. But what happens is there's no people. And so when we talk about neighborhood development at Martha O'Brien, we're taking a very broad approach. And I would tell you honestly, it is because we have tried all the practical ideas. We are now down to the impractical. So our strategy now is to make sure that what we are investing in and what we are asking our partners to invest in are those things that are the very, very highest priority. So the Promise neighborhood here in Nashville is the Stratford cluster. That's 13 schools. We do not believe that we will be successful unless the faith-based organizations, the schools, and that means down to the faculties, not just the principals, are engaged in this process. It is funded out of the Department of Education, so there's no question that a great school is at the center of every Promise neighborhood, and hopefully more than one great school. But we do believe that you defeat poverty in people's lives through education, work, and fellowship. At Martha O'Brien, what we say is this, is that it doesn't matter how cutting edge our programs are, it doesn't matter how good we are at what we do. The reality is if you don't trust me and I don't trust you and we aren't in a relationship together, then no change ever happens. And everybody in this room knows this. So when we talk about neighborhood development, it really has to be those who have and those who have not sitting together. And that's what we're trying to do with the Nashville Promise neighborhood and with everything that we do at Martha O'Brien. So we welcome all of your input. We have about 100 community members that are working on this, including all our principals. And interesting enough, things have come out that seem very basic, but just weren't there. Our elementary teachers said, we had no idea that there was 1,000 4-year-olds not being served on the east side. We actually lost a pre-K classroom to Antioch a while back because we couldn't fill the classroom. So this is really changing the way everybody works together. And I think, when you look at our sector, we could be criticized by saying we're still doing things we did in 1950. So we need to do things differently. We need to learn from each other. And that takes time away from the direct service that we're all committed to. So I just want to say that this is a really open conversation. You don't have to be in East Nashville to be part of this or to be in this conversation. And if we want to do community development, we really have to have everyone committed to the outcomes for every child in the city. That's how you change generational poverty.
In regards to workforce and economic development, federal unemployment rate as of September has dropped to 7.8, which is still a very high rate historically for our country. Unemployment rate here in Davidson County is well over 8%, and has been that way for several years. If a person lacks a high school diploma, the rate of unemployment doubles. And it's not much better even if you have a high school diploma. If you're anything other than a white, non-Hispanic male ages 26 to 64, you face a higher likelihood of unemployment. So much, as much as 5 times higher if you're an African American young adult. And we know that these numbers don't really, they don't reflect those who have given up looking for jobs or those who are underemployed. And if you could ever figure out those numbers and add to these percentages, we'd really be getting a more realistic look at people in our community that are struggling with lack of work. And then you add to these facts that during the past recession, the number of lower skilled, entry-level jobs available has also dropped as businesses pulled back. That's where they made cuts often. And that segment of the job market is always going to be slower to recover than higher skilled jobs related to technology and things like that. And so it's a bit obvious to say, but work or lack of work is directly related to poverty. In the 2011 Community Needs Assessment under the Workforce and Economic Development category, the 2 highest rated needs were help with job placement and help with job training or job readiness. And there are many wonderful programs and organizations in our community that are offering these services and trying to address these needs. But I'd like to take just a minute to tell you a little bit about LifeWorks of Nashville. LifeWorks' motto is transforming lives through dignity and work. Our goal is to help people flourish by providing an unemployment readiness program for adults who are economically disadvantaged, who struggle with unemployment or maybe chronic unemployment. We're an intensive, holistic program, and by that I mean intensive. We are a 9-week, 30-hour-a-week program, so our students are in class with us 9 to 4, Monday through Friday. They are, not only are we just talking about job readiness, employment readiness, but we're trying to wrap around that some other content as well. We operate on a cohort model. So we have a small group of students, 10 to 12 would be our largest class that we'd ever start with. But we work through the curriculum together as a cohort. We provide, not only do we provide employment readiness, which is about 1/3 of our time or 1/3 to 1/2 of our time in employment readiness curriculum, but we wrap around that some other life skill training. So we do some personal finance content, healthy lifestyle. We have a nurse that comes in and talks to our folks about taking care of your bodies as well as your emotional and mental health. We have a creative arts piece, so we're kind of helping people tap into their creative side. We're wrapping around that, some conflict resolution, some issues about generational poverty, some things like that. We also provide individual and group counseling. We know that as folks begin this transition and thinking about work and maybe going back to work for the first time, and for some of our folks in years, that's going to create some emotional and some anxiety, some stress, some emotional issues perhaps. So we provide some individual and group counseling. We're trying to bring alongside our students a mentor or a person that would just be their friend, to just walk with them kind of through some of this and be another person that they can talk to and have as a resource in their life.
Good morning. Good morning. I'm like Marsha, I know a lot of people in this room, so I worked with many of you, and I am grateful for this opportunity this morning to just be present here with you. And to those that I haven't met, I'm looking forward to meeting you here and having met you here today. My work is with the Community Partners Network. And this network is a network of service providers and faith leaders that have been the culmination of more than 20 years of serving in this community. Many years ago, under the watchful pastoralship of Reverend Edward C. Sanders, I was doing the work of a person who brought together people who lived with and were affected by HIV and AIDS. And I was having a wonderful time. I was serving people, I was holding people in my arm, I was studying at the divinity school, I was being challenged theologically and emotionally, and I was a nurturer by birth as a grandmother, and I thought I was just doing what the Lord would have me to do. And one day, Reverend Sanders handed me a grant about this thick and said to me, Neely, you can stay here and hug 30 people every week, and those 30 lives are going to be made better just because you do that. Or you can take this grant and you can teach 30 people how to hug 30 people, and 300 people will get hugged. And you can do the math from there. And that is how I came to do what I'm doing. And that's the work, and I'm sorry I might have jumped your question here, but that's how it is that I have dedicated my life. It changed my life. That statement from Reverend Sanders changed my life, because I truly love direct services. But I do know that we have to empower a community to change a community. And though I still hug those 30 people every chance I get, I am certainly hopeful that the work I'm doing is leading others to hug 30 people, or create programs that ensure that 30 plus 30 get hugged. And so that's what we do over there at Community Partners Network. What we do is 3 things. We do training, connecting to resources. That's why all of you are so important. And the third piece, that is an addition to the new organization, is we seek to build the capacity, aid in strengthening the capacity of small and large agencies by bringing together experts who are already out there in the field doing it, and allowing them the opportunity to do consulting work with those agencies.
The Rooftop Foundation is an organization of partnership with congregations in Nashville, Davidson County, dealing with rental assistance for people who are down on their luck, have a problem, particularly young mothers with a sick child who then get behind on their rent. So it's congregations working together to help people with rental assistance. It got started in 2005, late fall of 2005, when a lady came to our church, Christ Church Cathedral, downtown Nashville, asking for help. She needed $125 to pay her rent at the Stadium Inn between jobs. She was a waitress, had lost her job, and had to be able to have another job next week. So we helped her, but we started inquiring, where do you get rental assistance in Nashville? And 211 said, we're sending them to the churches. Thanks. So we ended up calling churches and found out that indeed that's what they were doing, is getting calls for rental assistance. We had an organization earlier, downtown churches for the homeless. It didn't work too well, but we still had the names. We called people together, and they said, this is not a bad idea, let's work at it. So we ended up, the long and short of it is, there are about 40, 45 congregations now that work together to help people in need. It helps them make sure that their money is being used wisely and well.
We start with room in the inn, and in the scriptures there's a story about the rich young man who says, what must I do to inherit the kingdom, or whatever the translation you would use. And he's told, keep the commandments, pay for your taxes, stop at stop signs, and that's enough. Isn't that's kind of relief, that just follow the law, and if we did, everything would be a perfect world. But he wasn't satisfied with that, so he said, what else must I do? And I think that the answer that he received is the same answer that brings us together in this room. What else can we do? Well, Room in the Inn started with a simple concept of providing food and a safe place to sleep for people who were homeless on the streets of Nashville during the winter months. And as we did that, we came up with the same kind of question of what else can we do? And so what we've been able to do since then is to create a whole single site of services, a comprehensive center that is our location known as the Campus for Human Development. We have the 180 congregations when we only started with 4 in 1986, and so beginning our 27th year, we're now going into 180 congregations all around the city and the county. Beyond that, we have the central site of services comprehensive center that primarily addresses 4 areas of need: employment, housing, medical, and education. So we have developed over the 27 years more and more extensive services in those 4 areas. And we're delighted to do this, but at the same time we realize that it never seems to end.
I appreciate being here. A guy at the Y told me the other day he'd gotten so old he felt like he'd answered a few of life's questions, but dang, nobody asked me the questions anymore. Thank you for asking me the questions. I want to mention tying Nashville together, TNT. Saul Alinsky, community organization, talking about justice instead of just talking about charity. There's a difference. And I want to remember with you the organization of TNT. It reached 71 organizations, including Nashville Electric Service and the Service Employees International Union. But 85–90% of TNT were congregations, Irene. And one of the split-offs within TNT was education. And what we found out was that Nashville had a paucity of after-school centers. And so we took our data, including, for instance, the fact that most pregnancies start in teenage pregnancies, and most drug habits start not 11 to 12 at night, 3 to 6 in the afternoon. And so we took our little entourage to see then Mayor Phil Bredesen. We presented our data, and it was a wonderful group of people, including Iman Ilyas of the North Nashville Muslim Center, principal of Rose Park, a number of people. We made our case, and we finally got the piece in the metro budget. And so those after-school centers began. To this day, PNA, which it was called, Project Neighborhood Aftercare, PNA is still in business. It still has 9 centers. It was greatly reduced in budget when Mayor Carl Dean took office and decided to redo the funding by metro government to nonprofits. It's not totally without merit to do that. But we've got 500 kids who are still in after-school centers with PNA, and the organization still goes on, and we hope it's expanding into Antioch with a couple more centers.